Hey guys, good morning. Dr. Sean here. We're talking about traumatic brain injuries and concussions in sports. And are we worried about it? Are they more prevalent nowadays? Things of that nature. It's interesting. I got my CCSP degree years ago, and it's a certified chiropractic sports physician. And one of the things you do with this is you're focusing on injuries that occur on the field. Whether it's in baseball or football or softball or volleyball, whatever it may be, you're focusing on acute care, trauma, and injuries. And I've done a tremendous amount of work with one of my acupuncture mentors who focuses on neurologic breakdown. You're looking at strokes, ALS, Lou Gehrig's, things of this nature, but also acute traumatic care, concussions, things of this nature. So the question we got asked here in our mailbag this week, saying, Doc, what do you think about traumatic brain injuries and concussions in sports? Guys, they're real. That's all there is to it. They're real. And football right now has really got a problem on their hands for the future, is how do we limit these type of injuries? Because as players have gotten bigger, stronger, and faster, the impact of force meets force, sometimes it's just too much. Now, little kids and things getting concussions, I would say that if you're probably JFL league and under, you're like 6th grade and down, the odds of it are slim to none because they're not moving fast enough. But once you start going through puberty, and you start getting into 7th grade, 8th grade, high school, now you start seeing more of these injuries occur. And it's not just football, right? Hockey's got the same injuries. Baseball can have head injuries where you're sliding into things. Volleyball, you can collide into one another when you're out there. It can happen really in any sport. So you have to just take some precautions. Now, what do you do if it occurs, right? What do you do if you have it happen? So, for example, if it's a concussion, all that means is your brain is a good example, is like a potato, I guess, for lack of better words, in a big jar of water. And that's your brain. Now you shake that thing, the potato's bouncing off the jar. Well, that's your brain hitting off the sides of the brain, the skull itself. And it can bruise itself, it can get damaged. The small arteries in the brain and things can become inflamed. And that's what we're seeing here. We saw this a lot with the NFL recently and all the work they've been doing now with traumatic brain injury and post-concussion syndromes and things of that nature. They've got a real issue that they've diagnosed. So we're looking at this and we're saying, so what do you do then if you have an athlete that has a concussion? My son loves to play baseball. All of a sudden he's out there and he's running into center field. He's getting ready to catch the ball and bang, he runs into the right fielder. And they hit heads. How do you help them? How do you get past that? The old method was sit and wait, hope it'll pass away. But what we've learned now is there's some really cool stuff you can do. One of the techniques, a doctor that's a friend of mine, Craig Bueller, taught us this. It's a nasal specific technique. You literally put a balloon into the nasal passage and you inflate it. Now there's multiple cavities there you have to do this with, so it's a certain technique that you do, but the results for concussion are phenomenal. Absolutely phenomenal. I know Dr. Bueller does a lot with pro basketball, pro football, a lot of Olympic winter athletes. And again, you see winter athletes, you watch them crashing down the side of a mountain on skis, and you can think, wow, I bet there's some head trauma there. So what you see is if you can do this type of technique, so obviously adjusting becomes very important, but the nasal specific technique is super, super important if you have a concussion. And what you're doing is you're saying, okay, the skull is kind of like a plastic milk jug, right? And when you go banging it around, all of a sudden it gets dents in it. You want to put pressure from the inside out to pop it back out. And in doing so, when you restore normal function to the cranial bones, all of a sudden concussions, guys, respond extremely well. Well, the same would hold true then with traumatic brain injury to some degree. Now, again, it depends on where or what part of the head it affects, but you can always assess for this. The next thing you do in my world, I'm an acupuncture guy. All right, I like acupuncture. Acupuncture has been shown to have phenomenal results with neurologic disorders, cranial disorders, traumatic brain injuries, loss and paralysis. It does an amazing job because it's literally helping the body to reconnect circuits that might have been damaged or tripped, right? If you tear down a phone line, you can't get a call through. So you got to rewire it. So that's one of the nice advantages to acupuncture. So this is a really good thing to ask, and it's a good question. So how do you prevent these things? If you're small children and things like that, the odds of it happening go down exponentially because there's not the impact and the force in their sport. As they get a little bit bigger, and they get more mature, then all of a sudden they get in trouble. I know Connor, my little boy, he took a baseball off the corner of a cheek, off a bat. Now that's a substantial injury, right? That one put him down pretty good, and we had to do quite a bit of work to get that all balanced back out again. And there's muscle work and all these things. I talk about MMR all the time on here. It can be effective for this, but this is a serious thing, and it's something worth respecting. So as you're out there and you're a parent, don't be paranoid and afraid, but be respectful and watch things. And if your child has a head injury of any kind, you got to get them in, get them evaluated, rule out what type of concussion, because there are different grades. There's a 1, 2, and a 3. Rule out the concussion type. Get them corrected before you allow them to return back to sports, okay? So I hope that helps you guys. I hope that's what you're looking for this. I'm always willing to do mailbags. I love doing them. They're fun. I've seen a lot of head injuries in my career over the years, so we have a lot of cool ways to deal with it. I'm Dr. Sean, the Robin Hood of Healthcare. Take care.